I'd love to hear your perspective regarding how it is that we have such incredibly good influences from psychiatrists, like I've mentioned, and people like yourself, yet psychiatry seems to have lost its soul. And um, what do you think's happening, and what happened?
Well, I think it's the same thing happening in psychiatry that's happened in all of medicine. And, kind of reflects the scientific materialistic paradigm in our culture, and it reflects, the power of the pharmaceutical lobby. Um, there's a paradigm that in both medicine and psychiatry that the way that you work is that you see a patient and hear from them and identify symptoms that they're having, and then on the basis of those symptoms you decide what is their diagnosis, and on the basis of that you prescribe a pharmaceutical that's meant to suppress the symptoms, or it can be like a procedure like surgery that is also meant to get rid of symptoms. But it's nothing about soul growth or about a person's like healing in terms of helping them realign with their life purpose, or like what they're meant to do here in this incarnation. That's completely like not part of the vocabulary, and even there's like an allergy to the sacred.
Oh my
And
God, that's terribly true.
it is.
It's sad.
It is, but like it's like follow the money, like there's there's just and when you hear about like the healthcare costs in the United States versus in other countries, developed
Yes.
first world countries in the world, and um, when you compare like outcomes, like we're doing terribly, but
Yes.
the corporations are really enriching themselves.
It's getting worse and worse, and you got to wonder how far can this go, before people finally wake up to the fact that it's not even worth going to doctors unless you're in a car accident. I think the orthopedic surgery aspects of it are still quite good, and in many ways improving.
Right. Trauma surgery,
Yeah.
unparalleled. Like if a person is having like a medical crisis, like they're septic,
Mm-hmm.
in shock, that's to stabilize the organism emergently, or, things like cataract surgery, fantastic,
Mm-hmm.
But anything that's like any kind of chronic condition, many of which are caused by our diet and our lifestyle,
Yes.
um, the treatment algorithms that doctors are obliged to follow or else risk being not reimbursed by the insurance company, um, do nothing to help those conditions. It's just trying to suppress symptoms.